Hi, Jackie Van Ruller here, and in today's video I'm going to be talking about eliminating back, shoulder, and hip pain. So if you're suffering from any of these things right now, this video is for you. And I also really encourage you and welcome you to share this with anybody you know who is suffering from pain in these areas, because using reflexology is an incredible way to help to retrain your nervous system from that stress state to that state of feeling good. And it's oftentimes that pain is caused because our nervous system is stressed, or we feel stress in certain ways. And reflexology is an amazing way to release stress, physical stress, emotional stress, and mental health stress as well. So the back oftentimes has to do with feeling supported. Low back, which can be shown in these two areas, have to do with a lot of times financial stress. And so if you feel stressed financially, or you feel like you're not being supported financially, or if you're worried that you may not have enough or may not be making enough money, that can show up a lot of times in the low back areas. Mid back can be about feeling guilt or shame. So things from the past that you're looking back on that you haven't released emotionally yet. And then shoulder pain can have to do with feeling like you have a lot of stress on your shoulders, like it's all your responsibility, not being able to enjoy your life. And so as we work these areas, notice if you're feeling that type of stress or that type of emotional stress that goes along with these areas. And notice that as you work these areas more and more, do you feel like you're able to release them and feel less resistant in those areas as well? So we're going to start. Let me pull up my face map here. And if you don't already have a face map, if you're not following this from my email, be sure to sign up to my email list and you'll get this face map delivered right to your inbox. And this is something you can print off and use whenever you need to. So we're going to start working the entire hairline. So this area is going to be low back, and we're going to be working up the back all the way to the shoulders as we get to kind of the corners of the hairline. So if you don't have a hairline, imagine where it would be, and you can work a bigger area if you're not quite sure. So just kind of work the whole area, and if you have a larger area in here, just work the whole area as well. If it's shorter or more curved, just work that. So we're going to start right here in the center of the forehead. With most of my videos, it really doesn't matter where you start. I tend to work from the top and work to the bottom. With this one, you want to start with this area first because this area can cause energy to rise, and it could lead to a headache if you finish with it. So we don't want to finish with this spot right here. So just working in there, and notice where do you feel lumpiness, bumpiness, tension, pain, and just give that area some extra love and attention. Just doing some nice circles. I'm not pushing in with the detector or with the magic wand, but the magic wand is weighted, and so it's doing the work for me. And so I'm feeling some stuff as I'm moving up here. I'm feeling some lumps and bumps right in this area of the mid-back. And so I'm going to spend a little extra time just working right in here. You can do some back and forth motions. For me, I'm just feeling resistance, but no pain or anything like that. So I'm just going to work it anyway because I want to really open up that area, make sure that I'm getting good nervous system flow through my back, working all the way to the corners of the forehead right in here. Taking a deep breath whenever you need to. Make sure that you're moving nice and slow. Now again, I'm feeling some lumpiness and bumpiness in this area. Ooh, I feel some good stuff right here. I'm just going to stay there for about 10 seconds. Maybe even slowing down. And for me, I'm just feeling resistance. I'm not necessarily feeling any pain or tenderness, but you might be feeling that, particularly if you do have some back pain. I don't have back pain right now, so that would make sense. And as I come over to the other side, I'm feeling some lumpiness and bumpiness right in here. Really common to feel stuff right at the hairline there. So take your time. Give it some good love. Don't overwork it. Don't ever work an area longer than 30 seconds. But stay there for 5, 10, even 15 seconds if it feels right. And you can always come back and do this a few times a day. If you have back pain, I would actually recommend that you do this 3 or 4 times a day to just kind of retrain that nervous system to release those feel-good chemicals and neurotransmitters instead of the stressful ones. Notice if you don't have less back pain as you do this day and for a couple of days or even just a couple times a day. Sure you work right in that area. The next area we're going to work are the kidney points. So those are going to be located corners of the mouth, all the way up to the forehead and then down just a little bit. You might feel a spot where your fingers kind of fit into, or they might be kind of elevated or raised. And these are the kidney points. Incidentally, low back pain is the #1 reason for hospital admissions, or for people to go to the emergency room. And what is located right at the low back? Your kidneys. So when your kidneys are out of balance, it can cause low back pain. So I'm working the right kidney right now. It's probably opposite on your screen. And I'm going to work the left kidney here. And those will correlate with the same side of the face. So if you have right low back pain or left low back pain, you want to work the corresponding area. I just like to work both sides because I can notice which one is more lumpy, bumpy, or tender. And I'm actually noticed that my left one is I'm feeling a lot more on the left side today. In general, I generally feel a lot more on the right side, so that's really interesting. Next, we're going to move to some points that are for pain relief. So 124 is about halfway between the brow and the hairline and about 2/3 of the way back, so about right here. And then 34 is right here at the inner brow. So what I'm going to do is just work this area here. Nice and slow, taking a deep breath. You can also go back and forth, or sometimes on this one I just like to do little affinity signs here, so little figure 8s. But whatever you do is good. If it feels lumpy and bumpy, stay there just a few extra seconds and let it work itself out. These are great points for sedation, so they help to sedate pain signals and help you feel better pretty much instantly. Also really great for helping you to sleep, so if you're having back pain and issues sleeping, really great points to work. Okay, then we're going to come to the inner brow. Okay, in those areas, and 124 and 34 are points that work well together, meaning that when you work them together, they have a better effect. Incidentally, 34 is also a great area for the shoulders. So as we're working this area, we're also working the area of the shoulders too. So if you tend to have shoulder tension, great area to focus on. And then we're just going to go down and work right between the brows. Another great point for pain relief and for working those whole upper shoulder area. We're going to work this entire nose. The nose is representative of the back, and so we want to make sure we get every little area in there. And wherever you feel some lumpiness and bumpiness, those are areas you want to focus on, staying for a few seconds. And then as we get right into this area, we get to the second kidney points on the face. Again, remembering that low back pain is one of the most common hospital admissions or ER visits. And as we work those kidneys, we're sending that healing, feel-good energy to the kidneys instead of those stress signals that we're usually sending. The kidneys respond to the emotion of fear, and so whenever we're in this fearful state in our lives, it can cause stiffness and stuckness. And oftentimes when we have low back pain, it's because we're stiff or, have difficulty moving. Now right here on this lower part at the point, or the nose, is point 1, and that's just an excellent point for low back pain. So if you're ever feeling low back pain, come in right in there. Now you can also go right onto this tip of the nose here, and this is going to get the coccyx. So if you have tailbone pain or stuff in that area, I would work this area really well. And for sciatica, I'd make sure that you get the nostrils, even in this crease of the nostril right in here. Go back and forth on that a few times. All right. Next, we're going to come up and get the liver point on the right-hand side. So right-hand side in line with the bottom of the nose, directly underneath the iris of the eye. Put the point for the liver. When the liver is out of balance, you can get kind of acute, sharp pain. So as we work this and calm the liver down, you might find that your pain becomes softer or even disappears. And then we're going to work the left-hand side in line with the flare of the nose and directly under the iris of the eye. And this is for the spleen, and this is for any muscular pain. So the spleen is about nourishing your muscles, making sure that your muscles are mobile, flexible, all of those things. So getting in here, and I'm feeling some good tension right here, so I'm working it a little bit longer. If you're not feeling tension there, work the other areas that you're feeling tension in a little bit longer. Okay. And then we're going to come down and get the 2 points at the top of the chin, right in here. And these are for any sort of like sharp, spasmy pain. This really calms that down. Working those areas. And the last point we're really going to do is underneath of the eyes on the outer part. This is an area that improves circulation, and it's also about this upper chest area. So if your upper chest is really tight and your shoulders are kind of pulled in like this, it can cause that back pain as well. And so this is about loosening up that area, increasing circulation as well, so you're getting good blood flow to hydrate, send nutrients, and make all your muscles more flexible. So this one feels really good. You might just feel a little release in your body as you're doing it. I know I did. I just felt it in my heart area. It's just like, ah, feeling. Notice if you're feeling that too. You might feel it on one side more than another. I felt it more on my right. My left, I didn't necessarily feel it, but it does feel like a great spot to work. And I'm covering a decent sized area right here. This is so good for circulation. It also enhances all of the other points that we've worked. And then as always, we're going to finish up by working around the ear. Incidentally, this area right in front of the ear also has to do with the back and spine. So you can work up and down, kind of releasing the spine and then coming back around the ear. I'm going to get right behind the earlobes and then circle around. So I'm coming down and working that whole back area again. And notice how you feel. Do you feel different than when you started? I wasn't having any back pain, but I do notice that I just feel a little more looser. I feel like my body just loosened up a little bit. I feel less stressed. I feel kind of excited to go do a hike next. I feel like my shoulders just kind of relaxed as well. I tend to carry a lot of tension in my shoulders. And even though I've worked on that quite a bit, I do feel like my shoulders just relaxed with that whole routine there. So notice what you're feeling in your body. Be sure to comment. If you haven't already followed my channel, make sure you're doing that so you don't miss any of these highly effective facial reflexology videos. I would love for you to be able to have complete and utter control over your health by being able to access your nervous system. So please pass this video along to anybody who can use it. If you need to buy a magic wand, please visit my website. This will be a very beneficial investment for you, I promise. And I will see you soon. Bye.